Enjoy life today because yesterday is gone and tomorrow is never promised. I chose to do my informative speech on childhood leukemia cancer. I picked this topic because I wanted to learn more about it and become more familiar with it. I would like to major in nursing and possibly go into pediatric oncology. I love working with kids and want to make a difference in their lives. Childhood cancer is not an easy thing to go through, and because of that, parents need to be reassured that there are doctors and nurses doing their best to protect your child. Within this speech, I'm going to inform you about the different types of leukemia, the history, the side effects, the symptoms, the diagnosis, treatment, and ways that families cope when their children have leukemia. Leukemia is the number one most common childhood cancer. According to Joseph Pano, a PhD, in his textbook Cancer, the Lifestyles, Environment, and Genes, he stated that nearly 32,000 adults and more than 2,000 children will learn that they have leukemia. In leukemia, bone marrow produces abnormal white blood cells, which then crowd the healthy blood cells, making it hard for the blood. The term comes from the Greek word leuko, meaning white, and hemia or emia, meaning blood. Around the 1800s, it was described as a distinct disease. Dr. Velpio was the first to come up with the first common case of leukemia, which he had an accurate description of. He stated that there was an enlarged spleen and pus in the person's blood. Dr. Rudolf Virchow was the first to describe two types of common leukemia: acute lymphomic leukemia, which affects the lymph nodes and affects children between the ages of 2 and 8, and acute myeloid leukemia, which affects children before the age of 2 or in their teenage years and affects the spleen. Doctors noticed back then when people died between weeks and months, it was from acute leukemia, and when they lived for years, they had chronic leukemia. Today, it is stated that childhood leukemia cancer is the number one most curable disease. According to Silverson and Nunn's textbook in 2000, in 1998, 140,000 people were living with leukemia. Leukemia is often very hard to distinguish because the symptoms are so similar to the cold, flu, or mono. A few symptoms may include tiredness, weakness, pale skin, infections, bruising or bleeding, an enlarged spleen, and excessive or a high fever. The cause of leukemia is unknown, and because of that, it is hard to prevent. They think some of it is from genetic disorders, or if you've had radiation or chemotherapy in the past, that can also be a part, or even environmental exposure. If there is a history of leukemia in your family, it is said to have regular checkups. Within a doctor checkup, he will check the eyes, mouth, and skin for leukemia. He will also check for excessive bleeding or bruising that you may have, and an enlarged spleen or liver in your abdomen. Then the first test that will be done is a blood test. Leukemia doesn't necessarily have a stage of cancer. Rather, it looks for how far the tumor has spread or how big the tumor is. It starts in the bone marrow, which is the soft inner part of the bone, and travels to the blood. Treatment often cures childhood cancer, and chemotherapy is the number one most common treatment that they will use, but it all depends on what type of leukemia he or she has. Chemotherapy can be given through the mouth or into the vein or into the spinal fluid. Intensive chemotherapy can have negative side effects as well, including losing your hair, weight gain or loss, an increased risk of infection or bleeding also. According to the Kids Health Online website, it stated that other types of treatment include drug therapy, radiation, bone marrow, and blood stem cell transplantation. Most cases of leukemia have high remission rates, meaning that once they no longer have evidence of cancer cells in the body. Finding out your child has cancer can be one of the most difficult, depressing, and heartbreaking news you will ever find out. Having cancer brings many changes and decisions to your child's life and brings a whole new outlook on how your child sees life. According to the National Cancer Institute at the National Institutes of Health in 2016, they stated that children may experience changes in appearance, including hair loss, weight gain or loss. They will mistake gender, and often people will stare at you. You can also have changes in your friendships or your feelings, often feeling sad, anxious, scared, stressed. To be able to entertain and distract your child when they have cancer is an important thing that needs to happen. Children often ask the question, why did it happen to me? And no parent wants to go through trying to answer that, but the easiest way is just say that God has a plan for you, and you need to have faith in Him and just trust in Him that He knows what He is doing, and He will lead you in the right path. And parents also need to try and find a way to cope. That could include staying active, finding a support group, writing to your friends and family, or just trying to relax. Hope this speech has informed you about all the types of leukemia, the history, the symptoms, the treatment, the diagnosis, and ways families cope when their children have cancer. It can be really hard, but parents need to know that it's the number one curable disease. So with saying all of that, parents need to know that there are doctors and nurses doing their best to protect your child.